Good morning, I am Marco Pisa, neurologist and PhD student at San Raffaele University in Milan. In the present study, we explored anterior optic pathway pathology in CNS demyelinating diseases. We know that the anterior optic pathway is preferentially affected by CNS demyelinating diseases, as optic neuritis is one of the most common clinical presentations in all these diseases. However, progressive retinal thinning also occurs without optic neuritis in both MS and NMOSD cases, and the pathological substrate of neurodegeneration in the anterior optic pathway is still under debate. We hypothesized that chronic inflammation is one of the main responsible for neurodegeneration in the anterior optic pathway in both MS and NMOSD. We therefore collected at the Oxford Brain Bank the widest cohort of anterior optic pathway samples to date, which consists of 29 MS cases, 6 NMOSD and 6 ADEM cases, and 5 non-neurological donors. We used Dublin immunohistochemistry to characterize demyelination, inflammation, and acute axonal injury in each case. We found that first, inflammatory demyelination is highly frequent in all these diseases. In MS donors, we found that over 80% of donors had demyelination in the anterior optic pathway, and importantly, 75% of them were active at the moment of death. In NMOSD cases, when demyelination was a feature, it extensively involved all the sampled area, and ADEM cases displayed a typical perivenular demyelination pattern. Considering the normal appearing white matter, we found that not only MS cases, but also NMOSD cases displayed an intense inflammatory infiltrate of both T cells, microglia, macrophage, and in NMOSD cases, also B cells were present. Considering the meningeal compartment, inflammation was highly frequent. It was invariably present in NMOSD cases, it was more severe in ADEM cases, and also B cells were frequently found in MS and NMOSD cases. All these inflammatory features in the normal appearing white matter, in the plaque, and in the meningeal compartment were associated with the presence and extent of acute axonal injury. Overall, over 40% of MS donors displayed acute axonal injury, irrespective of disease duration and age, and 2/3 of the NMOSD cases also displayed acute axonal injury at the moment of death. We found a clear antero-posterior gradient of disease involvement in multiple sclerosis, with optic nerves displaying more demyelination, inflammation, and acute axonal injury, while in optic tract we found a higher frequency of remyelinated shadow plaques, suggesting an inverse relationship between inflammation and remyelination. Finally, we found a typical loss of the perivascular rim of GFAP and ACUP4 staining in the plaque area of NMOSD cases, while in the normal appearing white matter, despite the intense inflammatory infiltrate, GFAP and ACUP4 staining were relatively preserved. I would like to thank for this study all the co-authors, the academic unit of neuropathology, and all the patients and next of kin who donated the tissue for research. Thank you for your attention.